Hello. You look so comfortable for a little bit.
I know, I was taking a nap.
Oh, okay.
Hello.
What's your name?
Christelle.
Christelle. Nice to meet you. What sport do you play?
Soccer.
Soccer. Okay, cool. What position do you play?
Forward.
Forward. Nice.
That's the position.
Okay. So what brings you in here today?
I guess yesterday in our game I was like running.
Mm-hmm.
And I was like dribbling the ball and like I tripped because I'm so clumsy. Right on my knee, and like now it's a little swollen.
Yeah, a little bit. I can see that.
Yeah, my left knee.
Yeah, I know. So did that swelling happen immediately, or was it up over time?
Like kind of slowly, but yeah, right after the
Slowly?
game.
Do you have any pain right now?
Not too much pain. It just feels like super stiff.
Super stiff?
Yeah,
So not really any pain, just the stiffness that you're feeling?
yeah, really stiff.
Okay.
Minimal pain.
Did you play through it, or did you just come out immediately?
I played for a little bit, but I started to get really stiff. So eventually they took me out because I was slowing down.
Okay. Okay. And so it's happened yesterday?
Yes.
Do you remember, like, you said you tripped and you fell on your
Yes.
knee?
Like directly on the like front part of my knee. I just fell forward.
You fell forward and just right on your knee? Okay. Did you hear any sounds at all, or any weird things happened after you fell?
No, I didn't feel any. I didn't hear any or feel any like sounds or cracks or anything like that. But like it just like swole up, like, and I like did not like to move it that much.
Okay.
Yeah.
Has anything been bugging you since yesterday? It's just like,
So like when if I sit for a long time, then like getting up
okay.
or like
So like our morning is hard for you getting up out of bed?
sometimes, yeah, just like getting up out of a chair
Mm-hmm.
or like sitting down into a chair, like anything that makes my knee like go like straight and
Okay.
because it feels really stiff.
Yeah. Okay. So, did you do anything when you got home to try and help it at all?
Well, it wasn't really hurting like all that bad, so I didn't ice it or anything.
Okay.
But my mom has been trying to massage it.
Okay.
It makes it feel a little bit better. It made it go down a little bit.
Oh, okay, that's cool. That's good. Okay. So if it's okay with you, I'm going to try and feel it out a little bit.
Okay.
Actually, what I should do first is observe it, look for any kinds of swelling or discoloration, any kind of any differences all in muscles and muscle imbalances, anything that could help me lead to like a diagnosis or so. And from what I've seen and what Christelle told me before, she has some swelling on her left knee a little bit compared to bilaterally to her right knee. I don't see much discoloration, just like the fluid that looks like the swelling there. Other than that, I don't see a lot of muscle imbalances or such. And so I'm gonna do palpations next, trying to feel around. Trying to see, because all of her swelling's in the central area, so I'm kind of gonna feel a little bit out here first. The joint lines, anything there, any pain?
It's not pain though.
It's not pain. Does it just feel weird?
Yeah, my knee just feels like it just feels like a bubble.
Okay, anything right here with your quadriceps tendon?
No.
No. Patella tendon down here, anything you're feeling down here?
Not too much, but I feel like some of the swelling like moved down a little bit.
Okay. I'm gonna try and feel it on the patella now a little bit. Going to the top.
Yeah.
Anything there? Yeah. Is that like just the weird feeling, or is that pain?
It's like a weird feeling. Like I feel like it's like I don't know. It's like a weird feeling.
Okay. How about out here? Same thing?
Yeah.
Is
Just around like that whole like center, like
Yeah.
it just feels weird.
Is there a certain spot that you notice the most? Is it more the central right here in the middle of your patella that you feel like the most swelling?
Like that's where I fell.
Yeah.
Like just like it was like right on it.
Okay, yeah. So after feeling some, I do feel a little bit of point tenderness on her, about the middle of her patella.
Yeah. Ooh.
Yeah. So due to that swelling, I'm assuming that it could be from something like bursitis, also could be just from overall, could have been a severe injury that led to the swelling occurring. But she did say she played through most of it, but then she just couldn't get through. So that could be a lot of different things. But it doesn't maybe lead towards the ligaments that much due to the fact that she did play through it a little bit. If it was more like a severe ligament sprain, it might not be able to play through that as much. But we're just gonna try and keep going through the eval as much as we can. So I want you to do now, I'm gonna have you do some range of motion. So do some motions real quick. I want you to start off with extending this knee out. If you can, just straighten it out a little bit.
It doesn't hurt, but like it feels like I can't do it.
Okay.
Like it's just like restricted.
Okay.
Restricted.
How about bringing it back? Bring it back to flexing?
Like, yeah, this one's a little bit better, but like I can't go all the way, you know?
Okay. How about this one?
Oh yeah, this one's fine.
Okay. That's good. Okay, does just relax and move it for you?
Okay.
Anything there? Or anything?
I feel it tight, but like, yeah, you could do it. It doesn't cause too much pain.
So you feel it tight, right?
Yeah.
Okay. Now I want you to go ahead and I'm gonna resist you now. So I'm gonna go out here. I want you to straighten your leg out again.
Alright. It's like so tight.
Okay. How about bringing it back? Same thing.
Yeah, it's just tight.
It
Like
takes-
I don't feel too much pain. Of course, when I first did it, like it
Yeah.
hurt. I was like, oh my gosh.
You don't have any like numbness at all in your
No,
right? I
it's
don't
just
assume
that
so.
like bubbly feeling, like there's something like in there.
Okay. Yeah.
And it's like squishy.
This one as well? I'm expecting the same, just the same normal results. Okay. Now go ahead and I'm gonna have you lay back. Just check hip because it could be from different muscles in the upper leg that connect to the knee. It could be some kind of injury to the muscle, so I want to check those as well. So I want you to just bring your leg straight up. Anything there?
No.
No? Okay. This one? Nothing?
Nope.
Okay. Nothing? If anything? No?
No.
Okay.
It's mainly like when my knee is like has to go into extension or
Yeah.
has to go into like bending,
Mm-hmm.
like flexion.
Okay.
But like when it's already in, like when it's already straight, like
Mm-hmm.
I don't really feel anything.
Okay. Okay. Can we have you lay on your stomach now?
Sure.
So same legs again. The same lifts again. I want you to just bring this leg straight up.
Like this?
Yep.
Okay, we're still good.
Still good. Here as well. Okay. I'm just checking for just if the ability to be able to do those things, those motions and stuff. So now I want you to sit right here at your table. Okay, so now we're gonna check the ankle just in case. So I want you to go ahead and plantar flex your leg, bring your ankles down,
Yep.
and then bring them back up. Anything?
No.
No. Going out. Going in. Most for the sakes of the eval, I would check for the passive and assisted as well, but we'll just skip past that and we'll just move on to the rest of the eval. And so, from what I've seen so far, it seems like a lot of swelling, and the motions that she's able to do lean more towards a bursitis type injury because of the swelling. So I actually want to start off with a sweep test, trying to see if I can move that swelling around. So I'm going to have her lay back again. So with the sweep test, I'm taking my knuckles. I'm just going to be going right along that swelling, seeing if it's going to move at all. Just like 2 or 3 swipes. And actually the swelling is moving immediately. And then one big sweep medially. And yes, the swelling has moved back to the middle. Actually, let me just make sure. Okay. So, swelling was moving. It felt a little bit watery, so it doesn't make me lead towards more bursitis stuff. But now I'm gonna check for I call them like the worst case scenarios would be a ligament injury causing that swelling to occur. So I'm gonna check for valgus and varus stress test. I'm gonna be holding the leg a little bit up in 0 degrees of extension, just the normal extension, and just applying pushing force of the leg immediately, checking for the MCL, and then pulling with my opposite arm. And then the valgus stress test, pushing laterally and pulling immediately. Any pain at all you're feeling?
No.
With this chest, you're checking for more of that pain as well as laxity. And the laxity is the ability to, of that ligament to move. Okay, yeah, nothing there. I want to check for ACL and PCL as well. So what I'm gonna have you do is flex your knee up. I'm gonna put your foot right here. So what I'm gonna do here is I'm gonna have the knees just like flex like this. I want to have put some weight down so that way the foot isn't moving. I can get the leg to be relaxed. In this case, she seems to be really relaxed since she's not really guarding as much. So I'm just be going here, pulling forward, checking for the ACL, any laxity or pain, anything there?
No.
As well as pushing back in, checking for posterior apprehension.
No, it just felt weird.
It just feels weird.
Yeah.
My thumbs are?
Not right there, but like more up, like in the middle maybe.
Yeah.
It just feels weird.
Okay. Even though I check posterior, I might want to check just for, let's take check for sag sign. So with this, I'm just going to have patient flex her legs up. I'm going to be just letting them relax. And I should be able, if it's a PCL injury, to see the tibia posteriorly translate a little bit. The tibia translate a little bit too much because the PCL's main action is to prevent the tibia from going posterior. Wasn't anything there. Let's see. I want to check just in case for a patellar fracture. So the best case would be like a tuning fork. I can easily just get that and check. I don't have one with me right now, but in the case of me do having it and I use it, I don't see any pain that the patient's getting from tuning fork. I could check for a bump. Anything there?
No.
No? Anything there?
No.
Okay. Just for the sake of checking for more of the extreme case scenarios, I want to check for meniscus as well. So I'm going to be, are you relaxed right now? Are you okay? So I'm just going to be pushing, let me see. So with this test for the meniscus, I'm checking for any clicking or popping when I'm doing the motions around. I want to be pushing more out with flexion and then back in when extension. Looking for any clicking or popping to occur in that knee. In the case of being a meniscus injury. Anything you're feeling at all? Any pain?
That feels okay.
Feels okay? Okay, then internally rotate the leg, same thing. Anything there?
No.
And then externally as well. Nothing?
Nothing.
Okay, you can relax. You're probably getting dizzy. So, I know, yeah. I wasn't feeling any clicking or popping. I could check for Thestes as well. And checking for that clicking or popping, but it doesn't seem to be like it because I'm not feeling any kind of apprehension or hesitation. I'm not getting any clicking or popping, any kind of laxity out of the ligaments. It's just not really a lot of pain. It's just a weird feeling of like fluid being in your knee. So to me, that sounds more like a bursitis injury. Mechanism injury does maybe lead towards a PCL injury, so I might be wary of that. But the sag sign is a really great test for that, and I didn't see any sagging in the tibia. So with that, I'm leaning towards it being more of a bursitis injury. In the case of being bursitis, icing would be a great option. Would help take away some of that swelling or help with that swelling a little bit. That massage your mom was doing was a really great idea. So what we can do here is do some milky massages to try and move that swelling up, clear out a little bit. How have you been feeling with like practice and stuff? Have you done practice recently yet, or?
Just super tight.
Just super tight. Yeah. So we can work on that some more. Try and clear some of that swelling out with some milky massages and possible ultrasound maybe to help warm it up. But a lot of it's just going to be just trying to get rid of that swelling, so all that ice, a lot of that milking can help get rid of that, and then we can get her back into playing. So yeah, any questions for me?
No.
No?